Good afternoon and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today is Sharon Sinkler. Thank you, Sharon, and thanks to everyone for joining us. We're back today because our data is showing changes in our local situation. We're seeing heightened spread of COVID-19 in our community driven by BA4 and BA5 Omicron variants. Let's take a look at the most recent data. The first chart you're looking at shows our weekly cases in correlation to where our risk dial has been each week. As you can see, we've had a steady increase in weekly cases since the beginning of May, when there were 301 cases. Now, 2 months later, cases have more than doubled at 671 cases for the last week ending July 9th. Cases increased over the last week in almost all age groups, and a few long-term care facilities and assisted livings are also experiencing outbreaks. Wastewater data is also showing a significant increase. Analysis over the past 3 weeks shows as virus particles have more than doubled. Wastewater testing is considered a leading indicator, meaning it precedes changes we may see in cases and hospitalizations. This supports the expected increases after a large number of gatherings over the recent holiday weekend and with more people traveling over the summer. The positivity rate is also increasing. At the end of last week, it was 22.2%. The positivity rate is not as reliable of an indicator for our local situation as it once was. And this is due to changes in federal lab recording requirements, and health departments are no longer receiving negative test results from facilities that are doing in-house testing. And self-testing is also impacting positivity rate. We'll continue to track positivity rate and report it on the dashboard, however. The 7-day rolling average of hospitalizations increased towards the end of May, but was holding steady in June at an average of about 30 COVID patients per day. Since the beginning of July, daily numbers again have been increasing, and today, 47 patients with COVID are hospitalized, pushing the 7-day rolling average of hospitalized COVID patients up to 39. This is the highest daily average since early March. With these changes to our local situation and COVID-19 increasing in our community, the risk dial, which has been in yellow since May 10th, is now moving to low orange. The dial has not been in orange since the week of February 23rd. Orange indicates the risk of the virus spreading in the community is high. That means we are more likely to come into contact with someone who has the virus. So here are some precautions we can take. Stay up to date on your COVID-19 vaccination, which includes getting a booster as soon as you're eligible. When you're unable to distance yourself from others, wear masks both indoors and in crowded outdoor settings. Wear a mask if you have symptoms, have a positive test, or have been exposed to someone with the virus. Get tested or self-test if you have symptoms or have been exposed to someone with the virus. And most of all, please stay home if you're sick. If you test positive, ask your healthcare provider about treatments that may be available to you. If you're over 65 or if you have a medical condition that puts you at higher risk for severe COVID, talk to your healthcare provider about taking additional protective actions. These public health recommendations are included in the guidance for Orange, which is now posted on the covid19.lincoln.ne.gov website. I want to stress that if you have COVID-19, it's important to stay home for at least 5 days. You can end isolation after 5 days or on day 6. If you are fever-free for 24 hours and your other symptoms have improved, you should continue to wear a mask around others for 5 additional days. You can find isolation guidance at our website, covid19.lincoln.ne.gov. Following this guidance helps prevent potential spread to others. A reminder that at-home tests are available at the health department in the main lobby on weekdays during regular business hours. We're located at 3131 O Street. Walk in and pick up one. Test kits are also available at all Lincoln City Library locations. Testing continues to play an important role. If you know you have the virus, you can take appropriate steps to limit the spread and protect others. We encourage people to report their home test results to us. A short form is available on our COVID-19 website in the testing section. I also want to share a brief update on our vaccination efforts for younger children. Children under 5 can now receive COVID-19 vaccine and benefit from the protection it provides. More than 600 children under 5 have been vaccinated in Lancaster County. Initial uptake hasn't been as immediate as we've seen in other age groups. Parents are taking a very thorough and thoughtful approach. We continue to work with partners to help parents get the information they need to make the best choices for their children and provide ample opportunities for younger children as parents decide they are ready. And here's a rundown of the clinics for children under 5 for the rest of the week. Tomorrow we'll have a clinic at the Health Department at 3131 O Street from 11 in the morning to 7 p.m. at night. On Thursday and Friday, there will be Health Department clinics from 8 a.m. to 4 p.m. And we have partnered with Complete Children's Health to hold a clinic on Saturday from 9 a.m. to 4 p.m. at their location at 8201 Northwood Drive. These clinics are smaller clinics that meet the needs of young children. All clinics are by appointment only. Schedule an appointment online at covid19.lincoln.ne.gov or by simply calling us at 402-441-4200. We also continue to hold clinics for those age 5 and older. You can find dates and locations on our COVID website. Safe and effective vaccines can better protect children and adults from severe illness from COVID-19 and hospitalizations. Vaccine is now available to everyone from young children to older adults, and we encourage you to stay up to date on your COVID-19 vaccination, which includes getting booster doses as soon as you're eligible. In closing, we're seeing higher amounts of COVID-19 in our community, which means we're more likely to come in contact with someone who has the virus. There are precautions we can take, including staying up to date on our COVID-19 vaccinations and wearing a mask indoors and in crowded outdoor settings. You can find the latest public health guidance at our website just below the risk dial. We'll keep monitoring the situation closely and its impact on our community. If we continue to see significant changes, we'll be back with another briefing to help keep everyone informed. And with that, I'd be happy to take any questions.
Pat, we have a question from
We're always looking at all the options available to us. Right now, that is not in orange. Something that we're considering, we're making that strong recommendation, and knowing, most importantly, that people need to be up to date on their vaccination. That's the greatest thing we can do right now to help our community. Joining us today, and remember to get vaccinated and get your boosters and wear a mask. Thank you.